Welcome to my Leadership Artifact 2 presentation. My name is Audra Kessler and I am a doc student at Penn West University in the Health Science and Exercise Leadership program. My presentation is on human trafficking in healthcare, identification, intervention, and clinical response for physician assistant students. My research for this presentation focuses on addressing gaps in healthcare education related to special populations. Human trafficking remains a topic that is limited or absent in many medical curricula. Through this artifact, I'm actively working to close the gap and advance scholarship that's aimed at improving healthcare professionals' preparedness to serve vulnerable populations. My leadership team consisted of faculty members from the Physician Assisted and Occupational Therapy programs, the executive director of the Children's Advocacy Center of Butler County, a caseworker supervisor from the Butler County Children and Youth Agency, and a student board member from our pre-PA club. My team members contributed to this leadership event through event planning, clinical expertise, frontline experience, community partnership, interdisciplinary collaboration, and student engagement, all to ensure that this event was comprehensive, educationally rigorous, and aligned with professional practice needs. For this initiative, I led the development and implementation of an educational session designed to prepare future healthcare professionals to recognize and respond to human trafficking in clinical practice. The session focused on identifying victims, delivering trauma-informed care, understanding available community resources, and clarifying reporting responsibilities. This semester, I intentionally expanded my audience to include occupational therapy students and undergraduate pre-PA students. Broadening my audience promoted interprofessional education, fostered interdisciplinary collaboration, and helped address a curricular gap in an area that many healthcare professionals encounter. Our speakers, Danielle Schmidt and Beth Cully, were selected based on their extensive expertise and frontline experience working with individuals affected by human trafficking and child abuse. As respected local leaders actively engaged in community education and collaboration with our regional health system, they brought clinical relevance and community perspective to the session. The presentation provided a comprehensive overview of human trafficking, including definitions, risk factors, and county-level data to conceptualize the issue locally. Particular emphasis was placed on recognizing clinical indicators relevant to healthcare providers, understanding available community resources, and outlining appropriate steps when trafficking or abuse is suspected. The speakers incorporated real-world case scenarios to illustrate practical application in the clinical setting. They also addressed child abuse and mandated reporting requirements, which are both essential components of care for a vulnerable population. The session was evaluated by the students through scanning a QR code that was linked to a Qualtrics survey. Feedback was overwhelmingly positive. The majority of students reported an increased awareness of trafficking and greater confidence in recognizing potential warning signs. Qualitative feedback indicated that students would value having a centralized list of resources available. My commitment to educating students shaped my decision to focus the session specifically on trafficking, an issue that is highly relevant to clinical practice, but often underrepresented in medical curricula. I intentionally structured the session to emphasize practical application to ensure alignment with my mission to provide clinically meaningful, evidence-informed educational experiences. My mission emphasizes community engagement as an essential component of healthcare education, which is why I chose to collaborate with local experts actively working with trafficking survivors. Inviting community leaders with frontline experience strengthened the content's credibility, authenticity, and applicability. It also modeled for students the importance of interdisciplinary collaboration. My vision of empowering well-rounded healthcare professionals influenced my decision to expand the session beyond PA students to include occupational therapy students and pre-PA students. This broadened the educational impact, promoted interprofessional learning, and reinforced the idea that identifying and responding to trafficking are shared professional responsibilities. Curiosity shaped the initiative's foundation by recognizing an educational gap and transforming it into a meaningful learning opportunity. Kindness influenced how the topic was framed and delivered. Given the sensitive nature of human trafficking, I emphasized the importance of creating a safe, respectful clinical environment where patients can feel heard and supported. Cultural competence was highlighted by teaching students to approach patient care with humility, respect, and to be aware of implicit bias. Lifelong learning was reflected through professional development for both myself and students through learning more about an underrepresented topic. Compassionate care was emphasized as students were encouraged to recognize the profound impact of even one single patient encounter. One of the most impactful components of the session was the discussion surrounding common myths and misconceptions. Trafficking does not always resemble the dramatic portrayals often seen on TV. It can be more subtle and may involve coercion, manipulation, or exploitation. By presenting realistic, locally relevant examples, the students were able to better understand how trafficking can manifest in their own community. Just 1 week after our session, a high school student approximately 60 miles from our campus was charged with 304 felony accounts, including traffic-related offenses involving minors. This event provided an opportunity for us to revisit the discussion with our students and reinforce that trafficking is not a distant or abstract issue, and that it is occurring in our region. This project had a meaningful impact on student learning, interdisciplinary collaboration, and curricular development within the healthcare education setting. Students were introduced to key indicators of trafficking, trauma-informed approaches, mandated reporting responsibilities, and locally available resources that enhance their preparedness to serve vulnerable populations with competence and compassion. Thank you for taking the time to view my presentation, Human Trafficking in Healthcare: Identification, Intervention, and Clinical Response for Physician Assistant Students. Listed below are the references I used when creating this presentation, which includes educational content and images. AI and Grammarly were also used to support proofreading and editorial refinement, including grammar, clarity, readability, and professional tone. All ideas, content, and conclusions are my own.